Cowichan-Ladysmith.
Thank you, Mr. Chair. I'd like to ask the Minister some questions about Lyme disease, or tick-borne infectious disease, or vector-borne zoonosis. The Minister is familiar with the constituent I represent. Her name is Mary McQuay. Her parents are very concerned about her ongoing and deteriorating condition due to her contracting Lyme disease, and she has had several diagnoses of this, but has been unable to get the treatment that she needs. And it's become clear to me and to other members of the opposition who have other constituents suffering similarly that the system refuses to acknowledge the presence of Lyme disease in BC and its prevalence, despite several reports that show that indeed Lyme disease is prevalent in BC. In fact, the BC Centre for Disease Control did a report 2007, Lyme disease review, which pointed to this fact. Their own surveillance reports show that Tofino, Duncan, and many other cities are hotspots for Lyme, and yet when people present with symptoms, they're met with a stone wall. And the Minister knows of this case. This case has become critical as the patient is now in a very grave state, has been dismissed because, quote, she's doing much better, but is having seizures, cannot walk, cannot talk, can barely breathe, and is in terrible, terrible shape. The Minister has promised help, but it has not been realized. Will the Minister offer better solution at this point now?
Minister.
Thank you, Chair, and I thank the member for his question, and I thank the member for taking the opportunity a few weeks ago to come to my office and have a discussion around his constituent and the concern that obviously the constituent has been affected by Lyme disease. So I find the issue of Lyme disease a very interesting and challenging one, because there is a very vigorous debate within the medical community around both what is the appropriate testing regime for Lyme disease and what is the appropriate medical practice in respect of Lyme disease. Now, I think the way that we concluded the discussion, the member and I, Mr. Chair, was that I'd be glad to try to arrange an opportunity for further testing for his constituent. The challenge here is that there is a regime of testing which has been adopted by the BC Centre for Disease Control. I believe that the vast majority of physicians in the province subscribe to that regime of testing that has been developed by the BC Centre for Disease Control. I have the details of that here, but I'll hold off on that. I'm glad to if members would find it useful. But BC CDC and the great preponderance of medical practitioners in the province have a particular view around how to test for Lyme disease and what the appropriate steps are to be taken around the medical practice in respect of it. So that debate has been going on for some time. Dr. Murakami, who is often the spokesman and proponent around those who believe that Lyme disease is far more prevalent in the province, has a view. I understand that there are also labs in the United States that have a testing regime that is significantly different than the testing regime at BC Centre for Disease Control. It is the view of the BC Centre for Disease Control that, in fact, that testing regime that is undertaken by some American labs produces way more false positives than is appropriate. And as a consequence, they believe, and believe firmly at the BC Centre for Disease Control, that the multi-level testing that they do around Lyme disease is the right approach. So that having been said, that's a very interesting debate within the medical community for me to observe and for the member to observe. The question then is, what do we do about the member's constituent who has medical issues, and how do we get to the bottom of whether her medical issues are driven by the actual presence of Lyme disease, which I gather an American lab has concluded, or whether she has another condition which we should be assisting the member and his constituent in getting to the bottom of, so that that appropriate medical treatment can occur. So I remain committed, as I was that day, Honourable Chair, to trying to find some way to get the right testing so that the appropriate course of treatment can be undertaken. But we do have this challenge. I mean, there's not many areas of medical policy where we have such a sharp differentiation of views among some physicians and other physicians, the preponderance of physicians, and the BC Centre for Disease Control. I'm not sure how to resolve that difference, but I was sincere when I said I want to try to find some way to get the member's constituent the appropriate testing and the appropriate treatment.
Member.
Thank you, Mr. Speaker, Mr. Chair. It is a lot more than an interesting debate in the medical field. It is critical for this constituent, and this is just the most critical of the constituents who I represent who do suffer with Lyme symptoms. It's just that she happens to be very close to death. That is the opinion of her parents, and they're panicking at this point. And there are many others, including a 7-year-old girl who received initial treatment, but the treatment has not been continued. It is my understanding that the tests that the BC Centre for Disease Control use produce at least a 50% false negative. But in any case, should the tests not be merely confirmatory? Because, of course, by the time the tests are able to be confirmed, the patient has taken on all sorts of co-infections that become that much more difficult to treat. If the minister were able to step up and say that we should be treating Lyme patients and eliminating Lyme as a potential, because the treatment, the initial treatment, if it's early, will not, and I'm not an expert, but this is what I have been told, will not pose a threat to the patient if it's one of the other conditions that might typically offer the same symptoms. So the tests, I think, should be confirmatory, and the treatment, initial treatment, would eliminate Lyme as the cause, or eliminate Lyme if it is the cause. Instead, people are left to suffer for months and months or years and years, and they develop these co-infections which become even more difficult than the treatment for the Lyme. So now this family has had to travel to Seattle on their own dime and see specialists there. They've now been accepted to a clinic in Redwood, California, but they can't travel by car because the patient is so ill. Most commercial airlines will not accept her because of her condition, and they're looking for the minister to offer a flight to that center for treatment, and for him to ensure that this treatment occurs, because there were commitments made. There were commitments made in the meeting I had with the minister, where the minister assured me that a Lyme literate specialist could be arranged to see this woman. And that did not happen. So I wonder if the minister could address those issues.
Minister.
Thank you. And the member wants to discuss this within the bounds of a parliamentary setting, so we'll do that. My understanding, based on the information I have, is that the patient was admitted to Cowichan District Hospital on April the 7th, 2008, that a series of blood tests were conducted. To date, normal findings from those, a number of consults in respect of the patient's conditions, that other physicians have been working on this issue. Again, I find it difficult to say, because I'm neither a physician nor an epidemiologist,